My name is Chrisoné Smit and I'm a sonographer at SCP Radiology. I love what I do and I'm really passionate about my work. And when we recently went overseas, we visited Salzburg and we did this little walking tour of the city or the town, the old town. Whilst our tour guide was showing us around, he pointed to a very old, not really an important house, and he said, well, this is where Doppler, Professor Doppler was born. And I immediately got so excited. And everybody looked at me, and then I had to explain to him that Doppler is what we used with ultrasound when we're looking at blood vessels. So this scientist actually brought about the use of Doppler with ultrasound. If you can get excited about something so small, then you're really still doing what you're supposed to do. So the main thing that you have to do when you're a sonographer is to take great pictures. Every little button on your machine has a function, and you have to manipulate those to take a picture and to take the best picture possible in order to demonstrate abnormalities, certain structures, something small like a nerve or a little calcification, something very important that can just indicate whether something is abnormal or not. I enjoy working for SCP because I do align myself with the core values of the company. And for the company, patient care is really important. I've always said that that's the most important part of my job, is working with patients, interacting with them, making a difference, even if it's just a small difference, or helping a doctor make a diagnosis. I feel that's what I'm supposed to do. And they've really created opportunities for me to grow, not only as a person, but also in my career. And I'm very thankful for that. When I finished school, I decided to not go directly into medicine, and I ended up doing beauty and skincare therapy. And after that, I worked on the cruise ships for about 2 years. And during that time, I met a therapist on board, and she did massages for pregnant women. And then she taught me everything that she knew. And when I came back, I actually worked for a laser clinic. But in that time, I really felt that something was amiss, and I really looked for something that's more interesting, more in depth. And in that time, I decided to look at other things, and so I looked at ultrasound, mainly or solely for just looking at babies, but this whole world went open for me. There's such a variety of ultrasounds and job opportunities out there. There's no limit. So I studied a national diploma at the Cape Peninsula University of Technology, and that took me 3 years to complete, after which I did my BTech degree, and then I did my ComServe community service, we call it, for a year thereafter. I think sonographers are in high demand, especially because of the skills that they have. A lot of sonographers are being outsourced overseas. We don't have as much qualified sonographers, and those that we have leave the country, and so therefore it's important that we educate and encourage people to do ultrasound as well. Ultrasound is a great job to perform every day, and that is mainly because you interact with people. You're part of a bigger team, and so you have colleagues and fellow sonographers and radiographers that you can bounce ideas and problems off. You also build up a relationship with referring doctors. And the last thing is other people in that team include receptionists, porters, hospital staff, nursing staff. So you feel part of a bigger team, of a bigger picture, and I think that's a fantastic thing. So a sonographer should ideally be somebody that's able to analyze a situation, analyze the patient's symptoms and signs and injury and history, and take all of that, look at it, utilize critical thinking skills and be able to solve a problem. And I think that is what keeps ultrasound interesting. You always learn something new, you discover new pathologies, you're never bored. And if you think you know everything, then you're on the wrong path, because there's always something to learn.